If there's one topic that strikes fear and terror into the hearts and minds of health business owners and their teams, it's any mention of money and the fees they charge for patients to see them, especially any talk about raising their fees. In this video, I'll show you why this is such a problem for allied health clinics and what to do about it so you can charge what you're worth and get it. One of the main reasons health business owners and their teams struggle in terms of getting their prices right or setting their fees and working out is they price by the textbook formula, an industry norm, or other, I suppose, pricing standard measures. So that's kind of the issues. And I was very fortunate. I remember when I started my practices many years ago, I was working with a mentor, and he said to me very clearly, probably the most important thing I ever learned from him: be very aware of being involved in any business where someone else controls your fees. So be very wary of being in any business where someone else controls your fees. Now, not long after my mentor told me that, I received a letter from one of the private health insurance companies in Australia. And it was talking about the new preferred provider scheme. So this preferred provider scheme was basically telling me that if I agreed to charge the fees that they allowed me to charge as being part of this scheme, they would send me lots of work. So, we'll pay you $50 for every consult you deliver, but you can only charge $50 with no gap. If you do that, we'll send lots of work to you and add you to our preferred provider program. Now, pivotal moment for me, because I remember sitting there when I got that letter and I looked at it, and my mentor's words were ringing in my ear. Never go into business where someone else controls your fees. I thought, hang on, they're trying to control my fees here. I'm not going to do that. I remember I threw up the letter, I ripped up the letter and just threw it away. Unfortunately, not everyone had the same mentor that I did or knew that. They might have thought, there's an opportunity, I can get more clients coming in. But again, they're controlling their fees. And that's exactly what happens these days we talk about Veterans Affairs in Australia, or workers' compensation, or in the States doing insurance work, preferred provider work in the UK, or NDIS, any of the other many different companies and third-party groups that are trying to control our fees. Let me show you a bit more about this and show you where this might come from. Now, here's a schedule of fees. This was sent to me by one of my great podiatry friends. This is the schedule of fees in a face-to-face consultation in a podiatry practice in Australia. Now, regardless of where you are in the world, this applies equally, but this is the Department of Veterans Affairs. So if you're treating Veterans Affairs, these are the fees you can charge. So initial consultation, $94.60. Short consult, $94.60. So follow-up footwear. So any of these consultations, the government is saying if you're seeing Department of Veterans Affairs patients, you can only charge that $94.60. If you go to their home, initial consult, $106.65. Short consult, $96. So this is an example what I'm talking about of a third party controlling your fees. So if you're taking on third party work, working for someone else is controlling your fees. It's no different if you're involved in the National Disability Insurance Scheme in Australia. Now, these were some money, basically what they will pay for each specific service if you're doing NDIS clients. So we've got for dietitians, that's $193 an hour in New South Wales, Victoria, Queensland, ACT, West Australia, it's the same amount. Remote, if you're in a remote area, it's $271, very remote. So even depending on where you are delivering the service, they're saying how much they will pay for it per hour. We've got the same for occupational therapists, $193.99. Physiotherapists, $193.99 in some states. Podiatrists, psychologists, speech therapists, the list goes on. Now, the other thing, so what I'm getting at is if you're doing this sort of work, you've got to understand there's going to be a consequence of that. So and we'll talk about that in a second, but be aware if you're doing work where someone else controls your fees, there's an issue potentially that's coming at you. I was contacted by some representatives from the Australian Physiotherapy Association not long ago. And they we're putting together a working party to try and come up with suggested minimum hourly rates for the provision of physiotherapy services. Now, they contacted me, said, Paul, because I'm involved in business education for health professionals. They said, Paul, we want you to be involved in this. What do you think? No, I said, no. I said, I don't want to be involved in it because I know in mentors' words ringing me is you don't want to be involved in a business where someone else controls your fees. So I said, I don't want to be involved in that. But that being said, at least they're putting some number out there that is getting an idea of what your service might be worth. So this is going to say, is 0 to 2 years experience, you should be billing out at 240K. So you should be able to generate 240 grand worth of revenue. In terms of degree thing, it's at least so that's $200 an hour. Years 2 to 5, you should be at least worth or charging out $225 an hour, up to $250 an hour if you're 5 to 10 years out. 10 years plus, $275 an hour. If you're 20 years plus, you should be able to generate or billing $325 per hour. Now, there was a whole caveat on this. This was based on how many hours they were available to work. You take out admin time, you take out holidays, sick leave, all these other things. But they worked out that so much per hourly rate, you should be generating 240 to 390K in revenue in a private practice in physio in Australia. And to do that, you've got to be generating between $200 and $325 per hour. Now, as I said, I didn't like the idea of that, but I didn't like being involved in it, but I got the idea of what they were trying to do. They're trying to at least make you aware when you put your fees on, you add up how much your therapists are going to generate, you got an idea of what your profit margins are going to be. So I wanted to let I wanted to let the market decide what they will pay, because if you can see those numbers we're talking about there, it's a classic commoditization play, which means the DVA, Department of Veterans Affairs, are saying every physio service is the same and we'll pay you a set fee regardless of the quality of your service. But no matter how good you are, if you're a physio delivering the service, you can charge that fee. NDIS is the same. There's some play in that regarding different hours. If you're more experienced, you should be charging more. But it's a problem in our industry because if you're involved in third-party payers, they're trying to commoditize you. They're trying to put you in a basket and say, we'll pay you a certain amount for this. The health funds did it with preferred provider schemes. They're trying to make you all the same. But if you look at 10 different preferred providers in an area, all providing, say, physio or chiro service, there's going to be dramatic differences in how good they are and what they deliver. But there's a commoditization angle from the providers. So my beef is to let the market decide what you can charge. You put your fees out there and the market decides if they'll pay that or not, instead of letting a third-party payer determine what they'll pay you for your service. If you're selling stock, for example, a tip for you, when you buy stock, let's say you're a practice owner and you're selling tape or you're selling balls, whatever else you're selling, sometimes the wholesaler will say, this is our wholesale price, but you should sell it for this amount. So they're saying what should be your recommended retail price. And they'll say some will say you should add 20% or 30%. Now, again, this is someone else controlling what you charge. Maybe they're just recommending, which is okay. But my suggestion to you is, what will the market pay for that? I don't think I'd sell a product if I could at least double it from wholesale to retail, and then let the market decide if they're going to pay that or not. And I think there's an issue here. We don't really know where our price point is. We don't really know at what point. In most businesses, we don't really know where that is, but I'll cover that in a second. Think about you and your practice though. Where did your prices come from initially? So when you opened your practice, where did your fees actually come from? If you're like me, I think I just rang around a couple of local clinics and thought, oh, okay, I'll put myself in the middle of that. Then this one's charging this and this one's charging, I'll just put myself in the middle. And in those days, a long time ago, it was $35. So for $35, they ran around, someone was charging 40, someone was charging 25. So I went to $35. Where did your fees come from in your practice? And think about it. You haven't really worked out if that's what they will pay. Will the people pay? Or is that just what you are happy charging or comfortable charging? Different thing. What do you look at? What are your current fees? and when did you increase them last? So what are your current fees and when did you put them up last? So many owners that I speak to will say, I've put them up 12 months ago. How much by? Oh, well, CPI. So cost of living, 3%, 2%. Or I went from $90 to $93. And it's interesting because when I do these sort of lectures with business owners, I'll ask them that question. I'll say, when did you put them up? How much them up by? And I ask them this question: how do you know if you've raised your fees too much? How will you know if you've raised your fees too much? And I ask the audience, and they'll come back with, well, people complain. Yeah, they say our waiting room is emptier. We're not as busy. People cancel more. They see that's how they would know. And I throw a spanner in the works, as I like to do. I say, well, in my world and the world I consult in with owners, there's only one real metric that will tell you if you've put your prices up too much. There's only one measure. And it's none of those things mentioned before. The metric that I would use is, did your profit drop? Let that land for a second. Did your profit drop? Because you might have a couple of people that whinge. You might have a couple of people who cancel, say that the new fee's too high. You might have us emptier, maybe, but maybe you won't. But none of those things make any difference. What really mattered is, as a practice owner, did my profit drop? Did me putting my fees up, did at some point I went over the top and enough people left and cancelled that my profit dropped? Now get this, I've been doing this business consulting gig 20 plus years. And I can tell you, in the whole time of me telling owners to put their prices up, none of them have ever decreased their profit from doing it. So none of them have ever got to the point where they went too far and their profit dropped. Now, what does that tell you? Well, the main thing it tells you is that you don't know what your market will charge, will pay. You don't know what the price point is. If you put your prices up to $150, $150, for example, and no one says anything, which is usually what happens, you put your prices up and no one says anything. What does that tell you? Well, that I'm not at the borderline of my price point. My people will still keep paying it. So you're not at your price point yet. So people say to me, well, Paul, if you put your prices up and no one says anything, what do? There's an argument, you put them up again, because you don't know where that price point is. So my suggestion to you guys, be aware of this. Think about when you've raised your prices, did anyone say anything, but often don't worry about it. Here's some implementation steps for you guys. Appreciate, based on what I've talked about so far, appreciate the limits placed on you by third-party providers. Now, the model that causes problems for you, and what usually happens is that, and think about the risks to you if they change what they're going to pay. We've seen it recently with National Disability Insurance Scheme. They won't pay different things. They won't pay travel and other things. You base your business on this amount and someone else's fees, and all of a sudden they decide to decrease their fees and your business model no longer works. So, and you don't just want to keep up with CPI, you want to be doing profit things. So be careful of third-party payment deals, because they limit what you can do and what you control in your business. So beware of that. Diversify your revenue streams. So you don't want all of your income to be coming from just NDIS or just WorkCover or just DVA, because any change to their payment scheme will dramatically increase your business through no fault of your own. We see that a lot with cash-based practices in the USA that we work with a lot. Or non-cash-based business, where they're trying to get out of the insurance model so that they can charge what they're worth and get it. Because the models over there, they're shrinking rebates, there's changing models, the insurance companies are cutting it. I know there's one US-based practice software company that I know who charges their clients, or their practice owners, between 4 and 8% of their top line revenue just to collect the money from the insurance company. So not only is the insurance company screwing you down on price, you're going to have to pay more to chase the money from them. So that's going to have a dramatic impact on your bottom line. Implementation step they like is raise your consult fees. It's kind of it's a scary thing to do. We worry about it. We get worried about what will everyone say. We worry what will our team say. But put your fees up. Let the market decide if it's too much. The fees for my Practiceology program are based on what the market will pay, and I'm always testing the market. People ask me in my lectures all the time, how much notice should I give when I put my fees up? Controversially, I always say none. You don't give many notice. You don't. It's gonna. I can't tell you how many email lists I'm on from practices, because I'm subscribed to their emails because of interested in what they're sending. But I get emails from these practices as if I was a patient that lets me know about an impending price rise. Paul, just want to let you know we've had, due to cost of living increases, and we've put our prices up. And then they go into a whole spiel about explaining why they put their fees up. Oh, that drives me mental. Like, just the market will determine. The more you make a big deal out of it, the more problems you have. Most people aren't price sensitive, they're value sensitive. Now, if you're giving great value, which you, I'm sure, are watching this presentation, you're great at what you do, your clients love you, they will pay, and they'll probably pay more than what you're charging them. So raise your consult fees, let the market decide your fees, and don't give them any notice. The other thing, the no notice thing, it stops your team stressing about it. Just turn up on Monday morning, change the computer and say, hey, Mary, we've decided to increase our fees. Here it is. It just solves a lot of hassle. People say, what if people complain? What if they say I should have been told? Pretty simple script. Just say, sorry, Paul, sorry to hear about that, but I'll just charge you the old fee today, and you can charge the new fee from next time. How's that? Like, problem solved. Just get on with it. The other thing, and the final thing, let junior therapists, so let your junior therapist do a lot of that insurance work. Don't spend your time doing low paid work. It's not in your wheelhouse to do that. So don't for any time do any of that lower paying work yourself. Juniors can do it, set price work. They can cut their teeth doing those sort of patients and getting value from them and helping them, but it's not worth your time. Anyway, I hope that was useful for you. I know it's controversial and it's topical, but money is a very, very complex issue, and we get a lot of psychological baggage, and your team carry a lot of psychological baggage when they come in and work with you. They're carrying their own issues. And why wouldn't they? They've just spent 4 or 5 years at uni on a shoestring budget, and all of a sudden they're asking patients to spend 100, 200, 300 plus money on them, and they've just graduated. So there's a lot of money baggage here. If you'd like to learn more about what to do about it, if you want to learn how to build a clinic that works without you and how all these money issues are solved, watch my free training. It's called Earn More, Work Less, the Practice Owner's Plan. The link's under this video. Hope to see you soon.